And now we have a colleague that coming from the Union de Pediatria Mediterranean Hospital San Juan de Dieu, Dottoressa Elena Codina. Please, the floor is yours.
Thank you. Good morning. It's an honor for me to be here today. I'm Elena Codina, a pediatric nephrologist, but now dedicated to pediatric environmental health at San Juan de Déu Hospital, one of the most important highly specialized pediatric centers in Europe. I would like to begin by talking about what environmental health is. Here you can find a very academic definition. It is an academic discipline that studies how environmental exposures in every life, chemical, nutritional, and social, influence health and development in childhood and across the entire human life span. But we can also find another definition about what is our health. It's important to refer to the exposome concept, greatly developed by the Global Health Institute, IS Global, where the exposome advocates for the idea that our health is determined by three spheres. The personal one, what we eat, the physical activity we do, what we work on. The external, the where we live, the noise, the pollution we are exposed to. And finally, by our biological responses. As it has been said before, the World Health Organization has announced its worries about how children are affected by, for example, air pollution, second-hand smoke, waste, and above all, by climate change. Some of these aspects are contemplated also in the Sustainable Development Goals. It probably goes without saying that climate change will play a major role in our health in the coming years. We know that, we know that global warming has been predicted and that this will bring the risk, among many other things, of more frequent climate events as heat waves, heavy rainfalls, drought, fires, and how all these contexts will affect children. Children are not small adults. Children have physical, biological, and behavioral features that make them more vulnerable than adults. Children have a generalized immaturity of all their organs and systems, especially the immune system, which can cause a lack of response to some environmental toxic exposure. They breathe more times per minute. They eat more food per body surface. They are curious. They put all in their mouth. They have no sense of danger. They breathe a level of the cars. And most importantly, children will have many years exposed to this pollution. And furthermore, they cannot decide what are they exposed to or avoid being exposed. It's our responsibility to protect them even since the preconceptional period. I want to show you this systematic review published in 2022 in the New England Journal of Medicine to express the concern of the medical community on how climate change will affect childhood. Data estimates that children under the age of 5 will suffer up to 88% of the disease burden attributable to climate change in the coming years. Because of this, in the middle of the 20th century, the American Pediatric Association began to worry about the effect of the environment on our children. This evolved until 1998, when the first pediatric environmental health specialty unit was created. And what are these pediatric specific units? They are clinical units located in hospital or primary care centers where pediatricians specialized in environmental health work together with other health professionals, such as pediatric subspecialties, nursing, obstetrician, or other professionals from other fields. Their objectives are to provide assistance to patients and groups, to train professional and environmental topics, to do clinical research, to advise local, regional, national, or international agencies, and to promote health and environmental knowledge in the community. As you can see, the entire territory of the United States is organized with reference PHSU. Boston Hospital or Mount Sinai act as referral centers of these units. In Europe, there are 3 PHSU, all of which are located in Spain. The oldest one, and reference for all of us, is the unit of Murcia. And since 2016, we have had another unit at the regional hospital Orolot. There are many scientific publications that support the need of the creation of these units. For this reason, at the beginning of 2022, we began the process of a unit in our hospital. With the aim of cooperation and creation synergies with the different specialties and a new approach to medicine, like wearing new glasses. There are 4 areas of action. The first area is about training other specialists or doctors about environmental health. So we have held talks and classes in different universities, masters, hospitals, and different organizations. We belong to the Catalan and Spanish group of work of environmental pediatric health. Another area is promoting environmental health in society. We have participated in the creation of scientific documents to help society acquire healthy habits, such as going to school by bike or protecting the schools from pollution hazards. 1 year ago, we published a book about how the environmental affect pediatric and pregnant women's health. It can be downloaded for free on our website. I'm afraid it's only in Catalan or Spanish at the moment. As you can see, we currently have different active lines of research. The most important one is carried out with IS Global. And finally, we are working on some possible ways of assistance with different specialties until we start our own consultation about environmental health pathologies. So these are our reasons to have created a PHSU in our hospital, its relevance and impact on maternal and child health, discipline, its imminent growth, its transversal application, our responsibility because of our high diffusion impact capacity, and because it fits with our mission and it meets our values, to take care for vulnerable people to achieve a better and fairer society. Thank you very much for your attention.